Hello everyone. Today we are going to learn about smallpox. Myself Vinoli, lecturer from Tibulam College of Nursing. Let's get on to the video. Let's see the objectives of the topics. At the end of the class, students will be able to understand introduction about the smallpox, anatomy physiology of the skin, definition, incidence and various types of the smallpox, etiological factor, and clinical manifestation, pathophysiology, transmission of disease, diagnosis and management, preventive measures and vaccines. Coming to the conclusion. Introduction. A highly contagious and frequently fatal viral disease. The disease is also known as by the Latin name variola and variola vera, which is a derivative of the Latin virus, meaning spotted, or varus meaning pimple. The term smallpox was first used in Europe in 15th century to distinguish variola from the great pox syphilis, believed to have begun in Africa and spread to India and China. Let's see the anatomy physiology of the skin. The skin has three layers: epidermis, dermis, hypodermis. Epidermis, the outermost layer of the skin, provides a waterproof barrier and grades our skin tone. Dermis, beneath the epidermis and contains through connective tissues, hair follicles and sweat glands. Hypodermis, the deeper subcutaneous tissues, is made up of fat and connective tissues. Definition of the smallpox. It is a serious infection disease that causes the high temperature and leaves marks on the skin. Types of smallpox. Variola has two prominent variants, major and minor. The variola major is a serious illness with a mortality rate according to the CDC of 30% or more in unvaccinated people, while variola minor is a milder infection with a mortality rate of less than 1%. During the era of naturally occurring smallpox, several variations of variola major disease were recognized. Types of smallpox: ordinary, modified, malignant, and hemorrhagic. Ordinary. The ordinary characteristics are the most common form 90% of cases in unvaccinated. The case fatality rate ordinary is 30%. The modified type is having the characteristics like a milder form and produces fever, smaller and more than superficial lesions will be there, and 2% of the cases is unvaccinated and 25% are vaccinated person. The case fatality rate for the modified one. The cases of modified smallpox were rarely fatal. The third type is malignant. The characteristics or lesions were flatter, evolved more slowly and colder, and 7% of cases in unvaccinated person. The case fatality rate is 97%. The fourth type of the smallpox is hemorrhagic. The characteristics are difficult to diagnose and rash accompanying by bleeding into mucous membranes and the skin, and less than 3% of the cases will be affecting. The near 100% of the case fatality rate for the hemorrhagic one. Let's see the signs and symptoms of the smallpox. The first phase is incubation period. Duration is 7 to 17 days, which is not contagious. The characteristics are exposure to the virus is followed by an incubation period during which people do not have any symptoms and may feel fine. The second phase is initial symptoms, which means prodrome. The duration is 2 to 4 days, which means sometimes it is not contagious. The characteristics are: the first symptoms of smallpox include fever, malaise, head and body aches, and sometimes vomiting also there. The fever is usually high in the range of 101 to 104 degree Fahrenheit will be there, and this is called the prodrome phase and may last for 2 to 4 days will be there. The third phase is yearly rash. The duration about 4 days will be there. It has the most contagious. The characteristics are a rash emerges first as small red spots on the tongue and in the mouth. These spots develops into the sores that break open and spreads large amount of the virus into the mouth and throat. Phase is pustular rash. The duration is about 5 days. It has a contagious one, and the characteristics are the pumps become bustule, sharply raised, usually round and firm to the touch as if there is a small round objects under the skin. The fifth phase is pustulus and scabies. The duration is about 5 days. It has a contagious one. The bustulus begins to form crust and then scabies will be there. By the end of the second week after the rash appears, most of the sores have happened over. The sixth phase is resolving scabs. Duration about 6 days. It has a contagious one. The characteristics are the scabies begins to fall off, leaving marks on the skins that eventually begin the bitter scab will be there. The most scabs will have fallen off 3 weeks after the rash appears. The person is contagious to other until all the scabs have fallen off. The final most phase is scabs resolved. It has a not contagious one. The characteristics are scabies have fallen off persons in the no longer contagious. Let's see the clinical manifestations about smallpox. The first, high fever, headache, body pain, vomiting sometimes can be seen. Rashes follows that pus-filled blisters that crust and scabs and fall off after about 3 weeks, leaving the bitter scar will be there. What does the smallpox rashes looks like? The first yearly rashes will be there. After your initial symptoms, the rashes develops on your tongue and the inside of your mouth and throat. Then red spots in your mouth become sores which break open. And spreading rashes, the rash spreads to your faces, then your arms, legs, back and torso. In about a day, it spreads all over your body, including the palms of your hands and the soles of your feet. The third look is the pumps on your skin fills with a pus, thick fluid will be there. There may be a dent to middle each pump. It takes about 2 days for the pumps to be filled with the fluid. The fourth look is pustular rashes, the scabies will be present. The pumps turn into pustulous forms, round lumps, and over the next 10 days, crusty scabs form over the pustules. The final stage is scabies resolves. Over about 1 week, the scabies fall off, leaving the scars. Pathophysiology about smallpox. This organism is transmitted among humans primarily by inhalation of virus or by droplet from oral, nasal or pharyngeal mucus of an infected person. After the virus enters in the human body through respiratory tract, it grows on the mucous membranes and then spreads to the lymph nodes where it multiples and then finally enters to the bloodstream. After entering the bloodstreams, the virus invades internal organs and skin. The time frame for intubation of a smallpox is 10 to 12 days. Transmission of the smallpoxes. How the smallpoxes spread to one person to another person. The first face-to-face contact, direct contact with infected fluids and contaminated objects through the air, and the virus can cross the placenta, but incidence of congenital smallpox is relatively low. Smallpox transmission does not occur through the animals or insects. Causes of the smallpox. Smallpox is caused by a variola virus. The virus can spread directly from person to person. Here you can catch the smallpox virus by being around someone who has it. An infected person can spread the virus when they cough, sneeze, or talk. Coming in contact with the skin sources also can cause you get the smallpox. The second cause is indirectly from the infected person. Here, rarely smallpox can spread through the air inside buildings, infecting people in other rooms or other floors. The third cause is through contaminated items. Here, the smallpox can also spread through the contact with the contaminated clothing and bedding also. But getting smallpox this way is less likely. And the fourth causes is a terrorist weapon potentially. The using smallpox as a weapon is an unlikely threat. But because releasing the virus could spread the disease quickly, and governments are preparing for the possibility of the treatment. What are the diagnostic evaluation to be done if you get the smallpox? The first thing is physical examination. This includes the skin and mouth examination to look for the small rashes, and if there is a moderate or high suspicions of smallpoxes, the doctor may order certain lab tests. The test may only be conducted in specially protected laboratories and known as biosafety level 4 labs. Then PCR test to be done. The PCR and restrictions fragments length polymorphine and analysis are used to identify the specific strains. Then ELISA test. And the serological test measures the variola virus, specific immunoglobulin and antigen to aid in the diagnosis of the virus. Immunohistochemistry electron microscopy also to be used to find the disease condition. The origin of the virus may be traced by the genome analysis of the virus. To the management. There is two types of management to be followed: medical management and nursing management. Medical management: antivirals, tecovirimat, cidofovir and brincidofovir. The nursing management is the treatment approaches include supportive measures, antiviral therapy, administration of varicella zoster immune globulin, and management of secondary bacterial infection. Coming to the treatment. The patient with a smallpox can benefit of supportive therapy such as wound care and infection control, fluid therapy, possible ventilator assistance, and antibiotic for any secondary bacterial infections that may occur. And the vaccine immune globulin can be offered to persons exposed to smallpox and prophylaxis. The vaccinations within 3 days of exposure can aid in the treatment by preventing or significantly lessens on the severity of smallpox symptoms the vast majority of the people are getting. What are the complications occurs after the smallpox infection? The most people who get the smallpox survive. However, some rare types of smallpox are almost always deadly. These more severe forms are most common in pregnant women and children. The people who recover from smallpox usually have severe scars, especially on the face, arms, and legs. Sometimes smallpox causes vision losses, which means blindness. What are the preventive measures for the smallpox? The smallpox vaccine is the only known way to prevent the smallpox in the exposed person. The smallpox vaccine helps the body develops immunity to smallpox, isolation of patients if they develop fever. And if a smallpox outbreaks happened, people with the smallpox would be isolated to try to stop the spread of the virus. Anyone who had contact with someone who had a smallpox would need a smallpox vaccine. A vaccine can protect you from getting sick or cause you get less sickness in the smallpox. The vaccine should be given before or 1 week after exposure to the virus. There are two vaccines are available. The first one is the ACAM 2000 vaccine used a live virus that's like a smallpox but less harmful it is. And it can sometimes cause serious side effects such as infections in the heart or brain. That's why the vaccine is not given to everyone. Unless there is a smallpox outbreak, the risk of vaccines outweighs the benefits for the most people. The second vaccine is Jynneos, uses a very weakened strain of virus and is safer than ACAN 2000. It can be used in the people who can't take ACAN 2000 due to compromised immune systems or skin disorders. The smallpox vaccine also provides protections against other similar viral infections such as mpox, also known as monkeypox and cowpox. People vaccinated as children. If you had a smallpox vaccine as a child, you have some level of protections against the smallpox virus. Trace the amount of antibiotics: polymyxin, streptomycin, chlortetracycline, neomycin. Smallpox vaccine. The smallpox vaccine is made from a virus called vaccinia, which is a pox type virus related to the smallpox. The smallpox vaccine contains the live vaccinia virus, not dead virus like many other viruses. Also, the vaccine can have side effects. The vaccine does not contain the smallpox virus and cannot give you smallpox. The only smallpox vaccines currently licensed by the Food and Drug Administration is Dryvax. The vaccine was first approved in 1931 and the existing lots were manufactured in the 1970s and early 1980s and stored frozen. Length of protection is the smallpox vaccination provides a high level immunity for 3 to 5 years and decreasing immunity thereafter. It is a person is vaccinated again later, immunity lasts even longer. Historically, the vaccine has been effective in preventing smallpox infection in 95% of those vaccinated. Receiving the vaccine is given using a bifurcated two-pronged needle that is tipped into the vaccine solution. The pricking of the skin will cause a sore spot and 1 or 2 droplets of blood to form. The vaccine usually is given in the upper arm. If the vaccination is successful, a red and itchy palm develops at the vaccine sites in 3 or 4 days. Receiving the vaccine. The vaccine is given using bifurcated two-pronged needle that is tipped into the vaccine solution. The pricking of the skin will cause a sore spot and 1 or 2 droplets of blood to form. The vaccine usually is given in the upper arm. If the vaccination is successful, the red and itchy palm develops at the vaccine site in 3-4 days. Post-vaccination care. After vaccination, it is important to follow care instructions for the site of the vaccine. Because the virus is live, it can spread to other parts of the body or to the other people. The vaccine virus, the live virus in the smallpox vaccine, may cause rash, fever, and head and body aches. In certain groups of people, complications from the vaccinia virus can be severe. I hope this video useful for everyone. Thanks for watching.